Hi, my name is Allison, and today I am doing the ophthalmic medication video for Nightingale College. So first I'm going to look over my doctor's orders, and the 6 rights for medication administration is I'm going to verify the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. So first I'm going to check the EHR. And I'm going to compare that to the medication and check the medication and compare them. So the order is for Timolol, 0.25% solution, 1 drop per eye, twice a day. Yeah, twice a day. Okay, so first I'm going to knock on my patient's door. Excuse me. I'm going to wait for their permission. I'm going to come in, close the door and or curtain behind me. For my patient's privacy. So first, before anything, I am going to introduce myself. Hi, my name is Allison. I'm going to be your nurse today. What is your name and date of birth? Okay, I'm going to check your wristband just to verify. Perfect. All right, Mr. Smith, do you have any allergies to anything? Okay, my patient verified he does not have any allergies. Okay, Mr. Smith, so today I'm going to be administering Timolol, 1 drop into each eye. It is for your glaucoma, which is the pressure within your eyes. Some side effects you might feel are dryness, redness, itchiness, watery eyes, and that can all be normal. You can feel some slight burning upon administration, but some adverse effects like shortness of breath and chest pain, or any serious side effects like also heart rate and other chest issues, respiratory issues, can be extremely serious. So you're going to need to report that to me. Okay, so first I'm going to perform hand hygiene. I'm going to put some gloves on. Okay, I'm going to observe my patient to see if there are any crusties that can be attached to the eye. So I would have like a wet rag, a warm wet rag, and I can apply that to the eye and let it sit there, kind of soak at the crusties, letting them soften up for maybe a minute or two. And then when I'm gonna wipe away, I wipe away from the inner corner to the outside. And then if I needed to, I could do it for the other side as well, using a clean rag or clean corner of a rag. Same thing, warm water, letting it sit there, soften up some of the crusties for maybe a minute or two, wiping away from the inner corner to the outer corner. Okay, I'm going to discard of the rag. Get rid of my gloves. Hand hygiene. Putting on bigger new gloves. Okay, perfect. So I make sure my patient is comfortable in a supine position in a bed. I have them raised up to me, bed rails raised for their safety. If I can't reach them, I can lower my side to get to them, as long as I know they're in a safe position. Okay, I have new gloves on. I'm going to take some gauze with my non-dominant hand, place it, I'll start on this side, place it on the bony prominence right below their eye, pulling down, getting my medication ready, and I am going to administer it about 1 to 2 centimeters above the eye, just 1 drop. If my patient blinks or if I miss the eye, I can do it again. So let's say he missed it down his cheek. I'm going to just dab it up a little bit. Okay, Mr. Smith, we missed that first drop. I'm going to go ahead and do another one. Keep it wide open. I'm going to use that finger to pull down on that bony prominence, exposing the lower lid of the eye. And I'm I'm just going to place one drop, 1 to 2 centimeters above that eye, okay? And he could blink it in. I can push it up a little, help him. And then I would put myself into a position to do it on the opposite side. Make sure I don't drop Mr. Smith doing this. Okay. Same thing. I'm going to take that gauze, put it underneath his eye, push down with my thumb, put my hand on his forehead, about 1 to 2 centimeters above, do one eye, or one drop in the eye. I'm going to make sure it gets in. Ask my patient if he has any questions, any concerns, put him into a comfortable position, make sure the bed is in a safe position. Bed rails up for his safety. Make sure he has his call light if he needs anything. Take off my gloves. Perform hand hygiene. Hi, Mr. Smith. If you need anything, use your call light and I will come assist you. Thanks. And then I'll leave the room, closing the door behind me and documenting any procedures I might have done.